good morning. Morning. I am so happy to have you all here today. I've mentioned to a few of you, this is our first educational workshop of the year and of the last few years, because 2020 was a write-off. And it is absolutely our, hello, welcome. There is a chair here if you like. Yeah, sit comfortably. If you want to sit on the floor, you can. Wherever you feel most comfortable. Yeah, that's okay. All right. It is absolutely such a pleasure to be here presenting this workshop in collaboration with DISC. They, as a facility, really care about education as well as integrated medicine. So we're really happy to help share that message with them. And it is my pleasure to introduce McLaughlin and Celina Bicho. Bicho. I always pronounce it wrong, sorry. Alison is or Allie, as she's better known, is a incredible pre-postnatal yoga and Pilates instructor and personal trainer and dietitian. Yeah. And she's going to share now a little bit of her personal story of why she learned about all the pelvic floor stuff and how important this is after having her 2 kids. And then Celina is an amazing pelvic floor physio that's based here at DISC. And no video. And she's going to be teaching all the practical, like the technical parts that we need to know so that we're supporting ourselves and our clients, for us that are coaches. And then the second half of the workshop will be practical. So we're going to learn how to breathe, what we should be feeling, and exercises that we can use in the early stages of pregnancy. And in my own opinion, these are exercises that everybody should be doing anyway, so that we have good functioning, healthy pelvic floors. So we're going to jump straight in. Thank you so much.
So my name is Allie, and yeah, as Jess was saying, I work a lot now with pre and postnatal clients, and because of the nature of my job, I actually have a company called RAD, and I sell mobility tools. So after I had my first child, I was more along the lines of just selling. I work a lot with clinics and just selling these tools. And then I realized, actually, I might need some help myself. So let me talk to the physios and everything about, what's going on with me. So I have 2 kids. I have a 2.5-year-old and a 6-month-old now, as of today, I think. Is it the 22nd? 23rd, okay, I was going to say. So with my first daughter, I don't want to say a rough birth, but I had some tears downstairs. I had a vaginal birth, and I didn't realize what the impact would that mean, and what was normal and what wasn't normal, because I had no idea. It was my first one. So after having that baby, I needed a lot of help, because I didn't realize that just these little tears, which I thought were normal, and a lot of women experience them, stopped me or prevented me from having access to my core. So when I went back to train, which I had no idea at that time, I was starting to do some crunches and some certain things, and I felt like, what's wrong? Like, I know that I was carrying a baby for 9 months, but how come I can't actually access or pull in my lower belly or pull in my core at all? And it happened after the education from the physios and everything here. It happened to be that I needed to release those scar tissue that I had during the birth to get access to that, which I thought was mind-blowing, how a scar could give me access to, again, that. And I also thought, which a lot of people, and I'm sure you'll go over, we're so lucky for her to explain the pelvic floor. I think it's so important for everyone to know about this, how there's 2 different sides, how one side, right now I'm experiencing one side after my second son. I had no tears with him, after my second child. I had no tears with him. It was also a vaginal birth, but one side of my pelvic floor can be completely different to the other. No idea. It can affect everything that you do. So now I'm taking more courses to get more educated in the pelvic floor to bring this to my ladies. It's so important. Things like, leaking when you jump or anything like this is not normal, and we think it is. Women are like, oh yeah, that happens after you have a baby. It's not normal, and we can prevent it just through breath. So I'm glad to see you guys out here to learn about that, because simple as knowing how to breathe properly, engage the pelvic floor, can change your whole experience postpartum. Yeah. So that's a little bit about me. I'll leave it, I'll pass it on now so I don't bore you guys too much. And then we'll learn more about the nitty gritty. And then she'll be using me. I'll help to cue a little bit later, but I'll show you the different ways to engage the core, that you know whether you're engaging just your obliques or if you're engaging the deeper areas that she'll let you know.
My name is Celina, as everyone knows. I'm a physiotherapist here in the disc. We're going to talk about pelvic floor, understand what is the pelvic floor and what is that. Learn what you expect if you have a vaginal birth or a C-section, because either with both situations you have a pelvic floor, so we need to take care of them. We're going to talk about what is normal and what is not normal. What is the red flags that you feel, okay, I need to go there, okay? And we're going to talk about also for the magic 6 weeks. Magic 6 weeks. There isn't a magic 6 weeks, but everyone say like, okay, I'm 6 weeks postnatal, I can do whatever I want. It's not like that at all, okay? Okay, so what is the pelvic floor? Welcome to the pelvic floor. So pelvic floor is these couple of muscles, okay? So we have superficial muscles, and then we have deep muscles, okay? And the superficial muscles is around the vaginal, the lips on the vaginal part, and like a triangle in our city bones, and around your anus, okay? Then you have a deep muscle here, okay, inside the pelvic area, and one side and another side. Even if it's one muscle, when you have a tear, for example, on the vaginal birth, they cut you on one side, not on the both sides. Or if you have episiotomy, they cut, if you don't have, you have a tear, probably you're gonna have a tear, small tear or not, it's here. Okay, so they will do it on one side. That's why I highly say like one side is completely different than another one. When you have a tear on your muscle, on your bicep, for example, you do the recover. So why you don't do recover when you have a tear on the vaginal birth? So it's a muscle, needs to recover, has scar tissues, needs to treat, and it's your support for your organs. It's all connected. It's one of the functions. It supports the organs because the organs are here. This is the vagina and the uterus, the bladder here. I'm going to show you where is the rectum. Here. This is how they are inside, okay? So when the baby is growing here on the uterus, right? So they are putting pressure on the bladder. That's why when you are pregnant, you need to go to the toilet all the time, because you don't have too much space for the bladder, okay? And then you have a rectum, and you have the vaginal bud, okay? And the baby goes out from here, okay? So can influence our bladder and our rectum as well, okay? So here inside, these muscles here are connected with the abs, okay? So here you have a belly. The belly is growing. How is these abs? How can we worried with the abs and not with the pelvic floor? They are connected. Behind, you have a muscle. You have a glutes. You have a hips, glutes. You have a paraspinalis on your spine. So they are all connected, okay? So one of the functions is support the organs. Another one is a sexual function, okay? Because as you see here, this blue thing is a clitoris, okay? The clitoris is not on the point. Is here behind the muscles. And for you to have a functional clitoris, you need to have a functional pelvic floor, because the pelvic floor is contracting and give the blood to the clitoris, okay? So they have a functional with the supporter organs, sexual function, and bowel and bladder continence, okay? Because when you feel that, well, I need to go to the toilet, this is a reflex from our brain to understand my bladder is full, I need to go to the toilet. But if you don't go, you're going to keep it there. You're going to hold the pee there, right? So it's your decision, go to the toilet, relax your pelvic floor, and do pee. So the pelvic floor is on your control. So we can work on that, and we can teach our pelvic floor to relax doing poop, doing pee. Okay? We need to have this control to control our bladder and our bowel. Do you understand? Any question? Okay? So the decision to go to the toilet, it's your, and the reflex time, my bladder is full, I need to go, is an automatic reflex, but then you have to have control on the bladder, okay? And then you ask me, okay, but I have birth, I can't control my incontinence, I have some leakage. Well, so let's learn. How can you control that? You can. It's not all the time in your hands, but because there are a lot of things can happen behind this control, of course, but there are things that you can do it, okay? Another thing that's really important is the pelvic floor, as I told you, is connected with the abs. And on the top of the abs, we have the big muscle called the diaphragm, okay? Diaphragm is the breathing muscle. So, and the innervation of the pelvic floor and the diaphragm is exactly the same nerve, okay? So when you work with the breathings, we also work with the pelvic floor, okay? That's why the breathings is really important. That's why the breathing is really important to be connected, because even if you don't know how you contract and how you relax the pelvic floor, you have the breathings. So you need to be connected with the breathings. And when you are pregnant, the diaphragm doesn't have space to move. It's on the top and it's really stiff. So you need to breathe, and you need to relearn again how to breathe with your diaphragm and connect again with the pelvic floor. Can you do this when you are pregnant? Yes, you can. You need the strength of the diaphragm to give birth, okay? It's helpful for you. If you are connected with the diaphragm, with the pelvic floor, your birth will be easier. If it's in our hands, it will be easier, and will be the work easier for you, okay? And give you a lot of information on time. So, importance during the pregnancy and after birth. I said this now, like labor, baby is growing, it's putting the pressure on the pelvic floor. But there are one thing that you should know, that working the pelvic floor, it's not only do Kegels. Famous Kegels is like, okay, do Kegels. How many women came to my room, say like, I don't know if I'm doing wrong or not. I don't know if I squeeze my pelvic floor or my jaw. I don't really know. Yeah, because the pelvic floor supports our organs like a basket. Okay, so it's on that position. When you have a baby, imagine if you have a bag with a full bag on your hands and you have to keep the bag here. How is your biceps? It's stiff, holding the bag. Okay, so after 9 months, drop the bag and try to move your biceps. Oh, you can't. Okay, it's the same with your pelvic floor. Pelvic floor, he's holding the baby for 9 months, and then you drop the baby. And then, more or less. And then you drop the baby. And try to move the pelvic floor. Oh, I can't. It's so stiff. It can happen like, well, and one more thing. During the labor, you have a really big stretching on the pelvic floor. And your body is so intelligent, so what we'll do is get stiff again. It can happen, or can be losing. And then try to squeeze. Oh, I can't. This is a trauma. Your pelvic floor also have memory. So whatever you do with your pelvic floor, your past history, your birth history, now we are talking about pregnancy and postnatal, but we don't know if you have any trauma or any history before. When you are childhood, if you have constipation, for example, if you are like this since you are a child, maybe your pelvic floor already have some troubles, and with the pregnancy, one more thing. Okay? I'm not scaring you. I don't want to scare people, but it's all about connection. And sometimes it's like my first assessment is most of the time is education. Okay? I spend 45 minutes explain this to the women. Okay? I don't teach them most of the time. So, we are done. Yeah, you knew that before. No. They need to know, and you need to be connected again. They need to change some habits. Sometimes it's like simple things that make a difference during the pregnancy and postnatal. Okay? Well, episode afterwards, episiotomy or tear, as I told you, if you have a tear there, it's a scar tissue, we need to treat them. Sometimes women lose the sensibility. You need to see how is one side and another one. The tear has 4 degrees, so depending on the degree of the tear, they have different cuts, and different parts of the pelvic floor. It could be only on the superficial muscle, deep muscle, sphincter, whatever. It doesn't matter. But there are different tears and different recovers for different tears, of course. Well, pelvic stability. You had a baby 9 months on your pelvis. And in 24 hours, in the bad case, 48 hours, you lose all the weight, all the baby. Okay? So your pelvis are recovering and healing, and to find the balance before you are like that. Okay? And now you don't have anything on the front anymore. Okay? So the pelvic floor, one of the functions is stability, and after the labor, it's also good to have this stability again. And if you are connected again, if you are connected with the pelvic floor, we can start, since you left the hospital, to work there and to give this awareness, this body awareness to your body from the pelvic floor. Okay? You can start like 3 days after birth. You breathe, right? If you breathe, you can start breathing here, here, or here. Why not? Even with a C-section. Okay? Okay, so control between pelvic floor, abdominal wall, and breathings. As I said right now, like after the birth, it's important to have this control. When you arrive at home, how many times per night you are laying down and bend on the side and stand up? How many times per night? 8, 7, sometimes more. So you need to have this control. I used to say that postnatal is a really, really hard workout all the time, okay? You are here changing, cleaning the baby, everything, and you stand and you sit and you lay down a lot of times, okay? So for you to stand, you need to have control on the pelvic floor. So if you already know that before, it will be easier. If not, you are on time to learn, okay? Yeah, as I told you, body awareness, coordination, endurance, resistance, fast. When you move fast, when you jump. This is not on the 6 weeks, of course. Just let you know that research said impact, like exercise with high impact, only after the 3 months. Okay, when I'm talking about impact, is carrying weight, CrossFit, running, jumping, whatever, after 3 months, at least after 3 months. But if you tell me, okay, but I only run before, I really need to run. My mental health really need to run. Okay, there are some options. I can't do it. Here in UAE, I can't do it because you have to put like a orthotis, something to hold the pelvic floor. But there are some doctors here, they do. But for me, it's much more important mental health than pelvic floor. Because if you tell me, I really need to go, my mental health is like, okay, so let's try to find some options to go, okay? But the research say like after 3 months, you can start. Doesn't mean that you can go, but you can start. But before all the exercise, high impact, yoga, whatever, you need to see a physiotherapist before, okay, to make sure. Because sometimes we feel, it happened a lot on my clinical practice. Women after 6 weeks, they are completely fine and came and like, okay, your body was amazing, did amazing job, you can. And after 6 months, when the woman starts to work, when the baby wants to go to the floor, when the baby is starting to be heavier, the woman is starting to have symptoms because they are not prepared for that. And I don't have anything, I'm completely fine. Okay, so that time, you should come again to the physiotherapy and learn again what you can do for yourself, okay? Well, woman body is really, really amazing. And I can say like 50% of the recovery, it's natural on the woman, okay? My challenge is teach for women that now you don't have any symptoms, but after the 35 years old, your estrogen, your hormones getting a bit down. So after this time, your tissues starting to be harder and less flexible. So, and that time, and when you reach the menopause, and that time, you're starting to have symptoms again, or you're starting to have symptoms. And my challenge is just convince women that you need to treat now, for in the future, you will not need me, okay? And if you have symptoms, if you already know before, and that time, okay, I just need to go back to the exercise or just need to connect again. It's like a lower back pain. We can have lower back pain when we are 10 years old and we did some exercise, it was amazing. Oh, today I have a lower back pain. Let me do the exercise again, okay?
I just want to jump in and say that your recovery journey is in 1 or 2 visits for many of us. So right now I'm 6 months postpartum and I go every 2 weeks to get my left side of my pelvic floor released because it tightens up. And I've just started to jump. So it's not my goal to do box jumps, but physio is, testing the pelvic floor now, so I don't have any leaking on that day to day, but when we challenge it, I'm leaking. So I still have some work to do with that. So it's not, a lot of women think it's like, oh cool, I got, this, when we talked about this, we hate this 6-week number. Okay, yeah, you can get moving and stuff, and I need it for my mental health. I'm not sure if you're talking about me. But in terms of, there's other things you can do, and women think it's like 1 or 2 visits, and it might be the case. I have a few clients where it is, but many of the times it's not.
Yeah, because sometimes it's not, okay, you cannot run or you cannot jump, but you can do another thing. You can cycle, for example.
Yeah.
So,
and depending on what you have, she was saying all the different organs. So with my second son, I had a bladder prolapse that I've now brought up. I just saw my doctor the other day, so I'm super proud. But yeah, the first one I didn't have a prolapse, so that will also affect what's going on.
yeah, but probably when I assess, I was not here. That's why she didn't treat me. But when you have a prolapse on the blood, I hate this word, prolapse. Well, forget this instability on the walls. Okay, vaginal is this canal, and you have anterior wall, posterior wall, and you have instability on that walls. Okay, when you put on the Google prolapse, you will see horrible things. Forget about this. I don't have child, and if you assess me, I'll have instability on my anterior wall. It's normal for everyone. Okay, don't be scared. But and after the labor, 80% of the women has prolapse or has instability on the anterior wall. Okay, but of course, if you don't treat, if you are not connected again, okay, getting worse. Okay, if you already know what's going on there, it's much easier. Okay, and as Allie said, like, I give you the tools. Okay, and then, sorry for that, but you need to work on you. You need to work your homework. You need to do your homework. Has everything. It's my approach. I can see you every week, but I don't like it. It's like a car. Going to do the checkup, treat myself. It's not with me. Sorry. You need to work. You need to work at home. You need to learn. You need to come again and the next week and tell me, like, I did this exercise, was so hard. Okay, so let's do it. Let's train. Okay? 35% the pelvic woman, the women's after birth cannot contract properly the pelvic floor. Like, it's on the research, it's not my opinion. Like, I'm not saying that all you need it, but you can come and say, like, well, your body is really amazing. I had one client, she's run an ultramarathon, she's high athlete, she had 3 babies, and when she come, after 6 weeks, I told her, like, go. You are fine. You don't need me. Okay? And if you practice, it's on the research again, it's not my opinion. If you practice exercise during the pregnancy, it's much easier to recover. Okay? Keep active. After birth, keep active. We want healthy moms. We don't want lazy moms. Moms are not, it's not lazy anymore, but we don't want that. We want healthy moms, and the exercise can be a huge things that you can do. If you can't do high impact, you can be 1 hour working on the floor. Okay? And about C-section, what do you think about C-section? Do you think they need a pelvic floor assessment?
Yes.
What they cut?
Some of the abdominal muscles, but when you're breathing, obviously it's not going to.
Yeah. Yeah, it's true. It's true. And you pass for the pregnancy time, right? You have been pregnant for 9 months as every woman. So the demand, I don't like to say that, but the demand from the pregnancy is the same, okay? The labor, some women pass for the labor and after 24 hours go to the C-section. So you have been all the hours pushing out and try and contraction and relax, and the pelvic floor is doing like again. You can imagine how traumatic it is. Don't be scared. It's a really amazing experience. It doesn't mean that it's bad, but like your body really know how you do that. Really, trust me, your body really know that. Okay? Hormones as well, like all the women has hormones. You have a huge hormone in our body called relaxin. It really helps you during the labor, okay? And that hormones is good for relax and give you flexibility. That's why afterwards, a lot of women in the first month still have some leakage. When I stand, when I cough, I have some leakage. That's normal. Well, we don't really know because we have a lack on the studies about that, but we don't have a board or a line that says normal, it's not normal. We don't really know because also it's depending of your experience, but don't be scared, I'm leakage, I will be like that all the time. No, the first month you have a relaxina, have a lot of relaxina in your body, so you still have some instability on the muscle, and the stretching and the tissues, everything during the labor can do that, okay? But you can recover. I have a lot of women, yeah, the first week I have some leakage, but then I forgot. Yeah, that's fine, okay? Family history, as I told you, if you already have some genetic things, it can be related. Medical history, if you had some trauma or something, it can be related. And body awareness during the C-section, it's the same. One of the things that Huma told me is, now I feel something different on my abdominal wall because I feel that something empty here. Okay, I have a full belly and then I miss something here. And it happened a lot during the C-section. When you have a cut on your arm or on the tissues, the sensibility there is really, really different. So that's why it's much important, and it's so important to treat even with a C-section. Of course, that we need to take care with some things. And if you find someone on that file, they will know, or they should know about that. There are some things that you need to take care, like abdominal sit-ups, or when you have a C-section, you need to roll on the side and take more care, of course. Okay? And what do you think is the pelvic floor assessment? What do you think is that? What I am doing? What is my job?
The connection between brain and muscle, between contracting.
Yes, true. More. No more? Oh, I'm looking for that. Yeah. As I told you, the first assessment most of the times is talking. I need to know everything. Sorry. So, gynecologist history. If you had a history of endometriosis, painful, if you are not regular on your periods, if you have some kystes, if you had some surgery, okay? It's not about only with the labor. Well, I can't. Postnatal history, how was your recovery till that time? Sexual history, if you had some pain during the intercourse. 4 in 10 women has postnatal depression. So that's why I told you that if the exercise will help you with that, I really prefer that you train something, that you do something that to be said, okay? And don't be ashamed to come and say, like, as a coach, you need to be open-minded for that, because sometimes they come as like, I'm leakage. I cannot do that. I'm leakage. And feel free to ask, how do you feel about that? You feel sad? You're not? Give space to them to have a small conversation with you. This is normal. It happens a lot of my clients. We are here to help you. Feel free to contact me whatever you want. Like, they need that. They need support, especially on these countries. We are so many expats. We don't have family close to us, and that time is really important to have support. Okay? Physical exams. So, breathing exam. I will ask you to breathe. Just breathe and let me see. Scar tissue. So let's see how is the scars. Even the C-section. It's good to work on the scar tissues. Skeletal examination. So sometimes a woman doesn't have anything bad, doesn't feel anything, but just have pain on the lower back, or even during the labor was so hard, or pregnant time, it was so hard as well. Okay, there isn't, we're gonna talk about that after. Joint mobility, okay. We have relaxiness, still have relaxiness, so our mobility should be fine, but sometimes it's not like that because you had the labor, so your body do the opposite. So after the labor, get stiff to protect yourself, okay? Especially if you have pain, you're gonna be like that, okay? So try to be 6 weeks or 2 weeks on that position, and then let's see how is your joints, okay? So the mobility on the joints is really important. And movement functional, of course, how is the movement? Posture in diastasis and internal assessment. This is the thing that when the patients come in, say like, you're gonna do the same like a gynecologist? No, I don't, okay? I'm pretty much funny for you. The pelvic floor is here. How can I assess the pelvic floor without touching? I can do breathings. I can just see how it's working. I can ask you a lot of questions and guess how is it. You don't need to do it. You don't really need to do internal assessment if you want to treat yourself. But I'm not 100% that I'll give you the best treatment because I don't see how is it, okay? And sometimes, and when I do internal assessments, it's good to explain. I put my finger through here and I touch like this, okay? It's not like a gynecologist assessment, like, okay? It just, this week I had a client say, okay, let's do your magic finger. It's like this, okay? Sometimes I put the finger here, but not more than that, especially if you have pain. I know there are quite physios like to work on that. I'm not that person. I don't like to work with pain. I don't know what is your memories about the pain, so I will remind the pain again, especially on that area. No way. Okay? So I can touch there and see like, well, there is pain. Okay. Just let me know. Okay? I don't really like to work on pain, especially with the postnatal and woman, because this is of course, this is a sensibility area, but I need to see how is that, okay? And for me to access this muscle here, I need to go there, okay? That's, as Allie said, like, my muscle here was fine, but that side was not fine. So how can I guess this if I cannot touch there? And then I will ask you, for example, to squeeze, to relax, to squeeze and hold for a bit, to squeeze and breathe. Okay, that's the thing to give me information, the endurance, how fast are you contraction, how can you contract. So how can I see the scar tissues? Okay?
And just to jump in on your pain comment, when they were releasing after my first child the scar tissue, it felt like I was giving birth again. So you have to work with your therapist or your physio to really, it felt like contractions again, like that's how it can be. And then for the trainers in the room, that's a really important question to ask, whether the scar tissue C-section or vaginal has been released. And if it hasn't, a lot of the times I say, I'll see you once you've got it released. I don't even bother, because I've had a lot of experience with more particularly women who haven't gotten released and they have lack of hip mobility. And then what can I do? I'm going to mess them up more if I work in that range and get them strong. And then if that ever gets released, then so I would just say, refer them to get their scar tissue released.
Yeah, and sometimes this scar tissue release can be do it with the tools that we work with the mobility, like a ball, like a roller, okay? Because the pelvic floor is here as well, okay? So we can work outside with the ball, with all things there. Even the C-section, we can work with the ball, okay? But it's good to see a physio. I'm pushing from my side, sorry. No, I just want to share my knowledge because I feel that a lot of people doesn't know what I can do, okay? So.
And it's important not to underestimate the connectivity between that scar tissue and somewhere in the body. You don't know where it is. It could be, likely it is going to be the pelvic floor. It could be a hip, it could be your person has a dead glute, so when they go into a squat, they only feel one side. Literally, it could be because of the scar. It could be vaginal or C-section. So once they get it released, you might find they have access to that butt cheek again, or whatever it is.
Okay, one important thing here in UAE and most of the countries, but in UAE, that's where we are, we need the doctor examination before a pelvic floor assessment or internal assessment, okay? Women sometimes come to me and say like, I want to see my pelvic floor, but have you seen your doctor? No, I don't, so I can't do it. Because if you have some infection there, if you have some troubles there, how can I know, okay? I only assess the pelvic floor. I don't assess bladder, uterus, and rectum, anything. Sometimes the rectum, if something clear, I can access and send you to the doctor directly. But it's really important to have this assessment from your doctor before. But it doesn't mean that if you don't have assessments before the 6 weeks, because most of the doctors has come on after 6 weeks or after 4 weeks. If you have some troubles between the 0 and 4 weeks, you can come, okay? You can come and say like, I will not do internal assessment, but we have a lot of things to work, and we still have time to work on the internal assessment, okay? Yeah. Red flags. The red flags that doesn't mean it's only on the 6 weeks, it's all the time after labor, okay? Incontinence or urinary problems. Well, thank you. I put some examples, things that people tell me, like when I cough, I have some leakage. When I jump, when I run, I have some leakage. When I carry something heavy, I have some leakage. After 2 minutes going to the toilet, I need to go again. So I go, do my pee, and after that I come to my room like, oh, I still have pee. This is another red flag. When I stand up after peeing, I have some leakage. You do pee and then you stand up, so woof, leakage. Okay? I go to the toilet more often after the birth. Okay? It's normal during the pregnancy, but could be not a red flag, but means that something is not working really well when you go to the toilet more than before. Okay? I often have urinary infections. If you have urinary infections all the time and you treat and then come back and then come back, it could be bladder problems as well, and the pelvic floor can help with that as well. It's called this is related with, just to give you the word, to hyperactive bladder, okay? Doesn't matter what is that, but just to have the word on your mind is the hyperactive bladder. It's like the bladder are hyperactive, that's it. Okay, so whenever the bladder feels pee there, you need to go, we need to go. It doesn't mean the bladder is full, but all the time the peeing is there, your bladder is irritating, so you need to go again to the toilet. Any questions about that? Okay, again, it doesn't mean this happen, but if happen, let's see. Bowel problems. I usually have constipation. Sometimes I have some stool leakage, so it's another problem. I can't clean myself properly. Women go to the toilet doing poop and it's hard to clean because they still have some leakage there. It's small, I clean myself and I feel like I'm not clean. I need to clean again. This is, for women, the most common thing is urinary incontinence, but can be bowel incontinence as well, okay? Don't forget about this and don't think pregnant have urinary incontinence, could be another things, okay? It's painful going to the toilet. It's hard to do poop. As I told you, the pelvic floor is on your hands to relax the pelvic floor to let the pee and the poop goes out, okay? And if you cannot relax the pelvic floor to do poop, it's hard, it's painful, okay? I never feel completely empty. Again, if you cannot totally relax the pelvic floor to feel empty, can be a problem as well, okay? Heaviness sensation. When I walk, I feel something between my legs. So I walk, it's like, oh, something is going out. What's happened here? It's really common. It's related with the prolapse, okay? When you have something there, well, something is not on the right side, the right point. I feel a bulge in my vagina. When I clean myself, I feel something there. It's a really high stage of the prolapse, but can happen, okay? When I'm sitting, I feel some discomfort. Again, it's like the underwear is not on the right place, you need to adjust something, that's it. So it's another thing that something happened there, okay? Lower back pain. What do you think about lower back pain? What do you think about lower back pain? It's a red flag? It's a red flag?
Well, I think a lot of people have lower back pain and they think it's normal. It's not. You shouldn't have pain in your back all the time.
Yeah, it's true. It doesn't mean it's related with the pelvic floor, but can be, okay? There isn't any research saying that if you have troubles with your pelvic floor, you have lower back pain. If you have lower back pain after the birth, it's related with the pelvic floor. I cannot say that because there isn't any research say that. But what the research says, if you have lower back pain, big babies, if you have big babies, it is related. Most of the women has prolapse, has big babies. If you have prolapse, it's because your tissues are so flexible. If your tissues are so flexible, you lose some strength. Means that you lose some strength. You need to have strength on your lower back to have a healthy back, right? Or should be healthy. So if you have these things, you can have a lower back pain. Okay? If you have history of lower back pain before during the pregnancy, it's another thing. If you already had before pregnancy, but I cannot say you have lower back pain, you have pelvic floor issues, okay? Sometimes a woman come after, I always remember one girl came in after 2 years birth, and I was talking with her about the lower back pain. She came with extremal. The word is like, I have lower back pain since I gave birth. Okay, so let me think about that. And I really understood she had constipation, she was on the different doctors, treating different things, and she only needs to be connected with the pelvic floor again. Okay?
I have a question about urinary incontinence.
Sorry?
I have a question about urinary incontinence. So I never had a baby. I sneeze quite often because of allergy. So it doesn't happen very often. But during my pregnancy, I think maybe twice. So it's not all the time. But then for the first time in my whole life, I feel a little bit of a lettuce. Is it something that can happen during pregnancy? Is it or?
It happened, but not common. It's common, but not normal. So there isn't any. Well, the study said that you cannot prevent a urinary incontinence during the pregnancy and after birth, but you can reduce the stage. Okay? If you start treating your pelvic floor during the pregnancy, you might doesn't have a lot of problems after, or the problems after will be less.
So I do try to have pelvic floor exercise as well. And for how often I sneeze, it was only just twice, but then I kind of like, what's happening? I'm doing exercise, but then I'm already having it even before I'm having my baby. So
it's a good question, Allie.
How often do you do pelvic floor stuff?
I was really good at second trimester, and I got lazy. But it started while I was doing it, so I know. She just spoke.
I have another question. Which exercise you would do?
She's a yogi.
Which exercise you do? You are a good example for that.
So there is the program that I'm following that gives you different postures. So you can sit on the bolster, but then it's usually
what they have to do.
So you learn how to do. I mean, okay, it's one of the things you don't know if you do correctly, but then you engage. Also, kind of way of imagine there's a blueberry underneath, and kind of smoothing in, not just squeezing, but lift upward and sucking in, and hold it for 10 seconds, releasing for 20 seconds. That's one set. And it can be 5 sets, and at the end do a little pumping.
Yeah.
But there's from just cross your legs, there's also one leg here, there's lying down and the legs up. So there's different ways. Some I enjoy, some just like, oh, I don't really like it, then I have to check out the time.
Okay, are you sure? Are you contracting your pelvic floor?
I thought I was doing, but also I got lucky, so.
Are you sure that you relax your pelvic floor when they ask?
I tried. So I feel it's relaxing. I can feel it.
When I saw Allie for the first time, I asked you to contract, and she contracted really well. No, she knew what is the contraction, and then I said, just relax a bit more. But I'm relaxed. What's going on here? I'm totally relaxed. No, you don't.
So that happened a lot for.
So for fitness, I find for people, particularly who are really fit, they don't know how to let go. Yeah, they don't know how to let go of the pelvic floor, so I had to relearn how to do that, and now I train everyone who I see that it's more important, and I think along the way you need to learn how to move the pelvic floor. It's just as important to lift as it is to let go, because then you can also run into problems that way. The way it was explained to me is like, if you never let go, and this is your pelvic floor, you're constantly squeezing up, you won't get the full lift of it. So you need to be able to let go of the pelvic floor so that it can lift
Yeah,
And
the
that
breathings.
sensation, like for me, I had my first poop, sorry, was terrifying. Like it hurt so much. So I guess the second time around I learned how to take little methods on how to poop and go to the bathroom a little better because that was painful for me. So I think that was part of the reason why I wouldn't let go, is because
The
pooping
memory.
wasn't easy, and that's a really overlooked thing. People think constipation is normal too, and it's not, and it can really impact the way you can move your pelvic floor. If you're not pooping regularly, and for me, after my first birth, it took me 5 days. I was terrified. It felt like I was gonna, I emailed my doctor, can my vagina fall out? I felt like it was so scary. It's terrifying. And then, so once you manage going to the bathroom, I felt that you can really feel the full pelvic floor movement there. Because to let go, you need to imagine that your sit bones are really spreading apart. And you can do that with some of the yoga poses I can show you. Okay. Like extended puppy pose, you can do it from that area because your sit bones are already forced to be spread apart. So breathing there is good too.
Yeah. That's what happened it happened a lot with the yoga. Well, I'm evidence-based, so they say really relation between strong abdominal wall and lower back pain and strong abdominal wall and pelvic floor issues, because the pelvic floor is connected here, okay? So if you have your abs so stiff, the pelvic floor will be stiff as well, okay? This is my challenge part. The woman came like, I do Kegels all the time. I love your question because it's like my all day. I do Kegel and I still have leakage. Yeah, but you are not really. What happened with the pelvic floor, as Allie said, is the basket. You are holding the baby, so you need to let it go. How many weeks you are? 32. 32. Perfect time to learn how to relax. Also, it will be helpful with the labor. Okay? Okay.
I was also scared of the constipation during the pregnancy, which I didn't have. So luckily, I don't struggle with it. I've been okay releasing. But yeah, if you guys ask me, are you doing correctly, then I never know. And also, it's really not easy to have checkup. Like, how do I really know?
That's why it's important to. Another thing that I used to explain in, put your finger here, okay, between the vagina and the anus, and see if you have movement. Okay, when you squeeze, your finger should be in, and when you release, your finger should go down. Okay. Here, for example, if you can. Okay, or even with one leg up, it will be hard, and the breathing is really important. There are the jaw. There is some study saying the jaw and the bladder, pelvic floor, and the abdominal wall is related. That's why, if you know some hypnobirthing or something like that, they used to teach the breathing during the labor, like, okay, because you are working with your diaphragm. I do like that, like, okay, you are working with your diaphragm and with your jaw relaxed and with your abs relaxed, and you are relaxing the pelvic floor. If you do the breathings like, it's hard. Okay, when you do that, you need to contract the abs. So instead of relaxing the pelvic floor, you contract. That's one of the things that I access with a pregnant woman, is when you breathe out, if your pelvic floor moves out and in or not. Okay? There are some measures that you should have during the labor, during the pregnancy. It means that your pelvic floor is flexible. Okay? So first 6 weeks, do I 6 weeks? There is a magic 6 weeks, or can I do, or there are things that you can do? What do you think about the 6 weeks? I think I give you the answer. There are things you can do, right?
Yeah, it's very individual.
Yeah. And also, yeah. So I think this is the time to learn what we can do during the 6 weeks.
Okay, so what I'll do is I'll show you my stomach so you can see the different types. If you want to come and see, you can. There's a few ways you can do quite a nice breath after birth from 0 to 6 weeks. And like you said, you can start after 3 days. I started, like I was in the hospital for 1 and I was just going there. So there's a few ways you can do it. Most women like to do it on their back because they can connect with the floor. I think the biggest learning from me is for your pelvic mobility, you do this anterior posterior tilt. Can everyone see? So like you really arc and round the back. You do that a lot for mobility of the pelvis. And what I was doing was I was pushing really hard into the back and squeezing, as you know, you assess my breath. And I was doing quite a real bracing. And you'll see, I'll show you the difference between like a bracing and a smooth one, and then one where I'm actually using the pelvic floor. And when we work with the pelvic floor, I never use the blueberry example. I know you love it. I hate it. When they say blueberry, I'm like, oh, that's so awkward. You wouldn't do that blueberry. So you want to work from front to back. So you want to think about holding your pee and then holding your poo and then releasing from that way, if that makes sense to you. Or like kind of when you're breathing like an elevator. So you're lifting up, the elevator is going up and then going down. And we'll go through all of that.
Sorry, so because also there is the breathing, because there is explanation about the diaphragm and the pelvic floor. When you're breathing, the diaphragm is going to relax.
Yeah.
And then this thing here will make you relax when you inhale the pelvic floor, right?
Yeah.
Okay, so you just exhale.
It's easier to contract when you breathe out, and it's easier to relax when you're breathing.
Yeah. So you can do this in a few ways. I brought my ball just to show you a few exercises that I've done. You can do it laying down, you can do it from the side, you can get different access to it. So coming from here, what I found really helpful is that if you are having trouble not bracing, doing like a normal crunch that you would do, or squeezing it quite hard, I actually got assessed with an ultrasound. And that's when I figured out, oh my gosh, I'm breathing just with my obliques. And I'm dominant with my obliques. So they said, you're not actually using any of your abdominals, you're just using your obliques to lift up when you work. But you don't normally lift those 0 to 6 weeks anyways. So you see from here. So I'm just taking a deep breath in.
Can you breathe like that?
Try. So my back is neutral.
Can you see?
You're going to have a general arc in your back anyways, but you don't want to be thinking about overarching, so major anterior or posterior tilt. Just a nice neutral back. And then from here I'll show you the bracing breath. So a lot of women do this to try to bring the belly in. So they'll just take an inhale, and then they'll exhale. So I'm not really, I can feel a little bit of engagement on the pelvic floor, but right now you can see that my obliques are doing a lot of the work. Okay. So from here, what I like to do is use your hands as cues and think about your tummy as more of a balloon. So you're filling all 360. So you're going laterally up and down everything. So you want to take an inhale, everything comes out. And then when you exhale, you're slowly lifting it. But I want to have it more from the pelvic floor. So whenever you use that blueberry, the elevator coming in. Trying to let go, so I'm not doing too well because I'm squeezing my sacrum, so I need to relax a little bit more. Around, whatever it is, and then go again. I usually bend my knees when I do this.
It's easier.
But I want you to see. Okay. Another way you can do this if you're struggling, that helped me a lot with this belly breath, is to actually use a balloon and to blow into it and try to bring in and up lower belly, because a lot of women find that they can't do that. So literally take the balloon and blow into it and try to lift up. Try. Now the ball for me was really useful. You don't want to, again, nothing's too like you're pushing too hard, but it's a little bit of feedback. You can use a ball, you can use a pan, similar stuff, correct anytime. Breathing in, and then just gently squeezing the ball just to get a little bit more
back in connection, and then bringing the breath in.
I
like to just hold for 1 to 2 seconds at the end, hold that lift, and not just automatically release it and make it fluid. Try to hold, and then as you get better, you can hold for 5 seconds. I never reach 10 seconds, but longer as you get better.
You can do this exercise, laying down on the side. Sometimes it's easier to, instead of pressing the ball against another hand, press the ball. Can you do it?
Yeah.
And also relax the pelvis on that position.
You can get a little bit more of the release from the booty, from the tailbone splitting apart. You feel that let go of the pelvic floor on the side. So it's here. So breathing in, watch the belly.
Here. And then go on that way.
So I can much more
feel the sit bones, the pelvic floor release from here.
The hard part sometimes is the breathing in. When you breathe in, you're breathing most of the time here, upper chest, or here. Okay, but I like to work first. The first thing that I give to the woman and have the hand. Can you lay down on the back? And breathe through your chest. Okay, this is what I don't want. Okay, I don't want this. I want to breathing here. Can you extend your legs? Breathing here on the diaphragm. Breathing here on the last ribs. So I used to say upper belly button, under belly button, and last ribs. Okay, can you give me a breathe here? Breathe out. Breathe in here. Breathe out. And here is a bit harder with the here. Yeah. Can you see the difference? This is one of the things, and also with the C-section. C-section is here or a bit low. So sometimes in the first weeks it's hard because you have a scar there. But if you're starting to connect with this point, it's really helpful. No.
Yeah, just like that.
Yeah. Instead of doing like, okay, because here I'm holding with my head, just let it go. Okay, if you're having
trouble lifting too, that's also, I like S breath sound like a snake. If you're having trouble lifting, that's a really good connection. The lift, not so much the release.
Yeah.
Yeah.
It's really dependent on what you want to work. If you have connection with the contraction, but you can't release, you don't want contraction at all. You can work with the breathing just for release and let it go. And then breathe in, release a bit more, and let it go. And breathe in, release a bit more, and after breathing out, you can squeeze. Okay, so you stretch the pelvic floor, and then you have bigger contraction and more range of motion. Okay?
This is the same one we did with the band, but with the ball,
squeezing, so it's the same. So breathing in, and then breathing out. And you don't have to pull it all the way. You can just get that connection, bringing it in.
As I mentioned before, your yoga, your extended pose, I found this helpful with the let go, because I struggle with the let go of the pelvic floor, was coming down to here, because you're forced to separate your sit bones. So your head is either on the ground or your chin, maybe you have a pillow there, or maybe a bolster. A lot of women can just be here on the forearms. And then when you take the inhale, the belly goes out. And I really feel my sit bones spread apart. They're already apart. And then on the exhale, you don't want to push too hard at this stage, 0 to 6 weeks, but just bring it in through the lower belly up.
It's a good position also for the last weeks during the pregnancy. and during the labor anyway.
Yeah. Okay, any questions? Similar, if you're having trouble also, depending on if you feel more comfortable seated, you can do, it's the same thing. With the breath, right? We're just doing a different orientation, so you might be seated and up here. I used a lot. I found touch really helpful. And obviously at the beginning it wasn't, so you can either hold there or feel what's going on. I used actually, I did it a lot in standing position at the beginning because I was really struggling. I had 3 tears with first birth, so I didn't really want to sit down too much, like especially like this. So I would do it standing. So you're gonna laugh. I would lower the shower head to hit like the side to hit my belly, and then I'd be in the shower like this. So imagine the shower head's low, just hitting here, reminding me to like go in. And I would just take any stance, like the knees can be slightly bent. I'm trying to, here we go. Knees can be slightly bent, and then I'd rotate hands, so I do 5 on each one. And again, I take an inhale, and kind of a similar extended puppy pose, sit bones spread apart, belly out, and then exhale. I would gently push into my hands and let the belly come in. So it'd be like here, so I'd be pushing. And then exhale, push into the wall. And then the water would be on my belly, reminding me to go in, and it felt nice. So again, any of these variations can be done seated, standing, on the side is a great one to kind of get that connection. And I would say 3 days is great. Sooner better to get it in. You'll just find you'll connect. And that progress of connection helps your mental health as well. Each time you feel it more.
Yeah. Especially the breathing. First weeks is really, really helpful. And when you come, you already have a homework. So what I did with the postnatal woman, sometimes after 2 months, you already know. So you can start doing before, okay? I have a couple of women that don't touch themselves at all on the first month because they feel shame, feel shy of the belly, and the belly is the feeling that I told you, it's empty, it's a bit weird to touch there. But guys, this is the best thing that you can do for yourself. Connect again with the tissues there, C-section, try to touch there, try to look into the mirror, to see your belly, to connect again with your body. It's really, really helpful. And well, last week I have a girl here, like she's with a lower back pain, she's holding the belly all the time, like she had still a pregnant belly, not like, so like that all the time, and the pants on the top, and like, I'm holding like that, and when I put the pants down, she's like, don't look at me. Yeah, did you touch on your belly before? No way. And my first assessment was just conversation. Explain this for her, and the next appointment she told me, like, my whole life changed. I feel much more confident with my husband. I have really good relation with him now. I don't have lower back pain anymore. I'm not in stress anymore. I accept myself. So it's your belly. It's your amazing body, do the amazing job. So just to be connected with them is really, really helpful. Okay?
Mobility of the pelvis we showed, so the anterior posterior tilt.
Yeah.
That's really great to do after as well. That will help with breath, with breathing too. Eventually you want to take out that really hard for that round. So this is a great movement for the mobility of the pelvis. You'll see the arc and the round, and you can exhale the same period as exhale and tuck under. You eventually want to do this so that the pelvic floor is moving that and not you physically moving your pelvis. If that makes sense. Yeah. So this is great mobility, circles up and down. Does anyone have any questions on the breath? You can start to advance it as you get, but I don't have a lot of people who can start to Until after like 4 weeks, I have a few you can start to lift the leg and do more things without using the obliques, like truly coming into tabletop position. Yeah.
So you guys are talking about the importance of breathing.
Yeah.
But what if it happens to happen? Like a habit, just a general habit, like breathing just from the chest, not
Yeah.
not necessarily postpartum.
Yeah, I mean, it is a habit for most of us, really. We're just always on the move, and yeah, you guys have other kids, so it's like, yeah, you were here. But I would say, well, I do. I would say that you need to set the time aside every day to do, like for me, it was 10 minutes of breathing. I would do my pelvic work every day, no matter what. To this day, I still do that. Just like I say 7 to 10 minutes at least if you can. And then you just know that you've worked on yourself in that way. And yeah, day to day, it's really hard to reset yourself, but it takes time. This kind of long exhale and breathing in and holding for a couple seconds, it's not what we would do on our daily basis, but you do have to take the time aside to train it.
Well, to be honest, like for me, this part is like almost non-existent. My breathing is mainly from here.
Yeah.
Unless I'm conscious about it.
Yeah, but that's the thing. If you have it's like a workout. If you work on that, starting to be a natural thing instead of here. But of course, you are in stress and everything, so the time that you spend these 10 minutes makes really different. I don't want, also with the pelvic floor, I don't want you are holding the pelvic floor all the time. But when he needs to work, he works.
Yeah.
That's the thing.
That's why I gave the example of the shower, because I knew that I'd be like, okay, I just need 10 minutes. So I could do my work in the shower at the very beginning from 0 to 6 weeks. There's so many doctor's appointments, so I would do it sometimes just in the car, seated, because I was like, oh no, I haven't done my work today. And I really make a point to do it every day. Because if you don't, you won't see as improvements as fast. And I didn't do that with my first one, and my second one I did. And it was a much different story, recovery-wise. Yeah, when you make the effort to do it. Start with that. Start with the, you've agreed to do it 7 to 10 minutes per day, and then, if it becomes a habit, great. It definitely should be when you're training. So we're just going to show some exercises with the band now, because a lot of women, including myself, get antsy after. Just if you're used to being active every day, and then you take that away, you want to do some stuff. So we had a kneeling press, right? We like kneeling, yeah?
I think so.
So then in here, we want to try to exhale when we are doing something hard. Yeah? So if I'm doing a kneeling press from here, I'm going to push the band up, and that's the hard part of this. So I'm going to take my exhale. I'm going to inhale, and then I'm going to exhale. Again, I would argue that slower movements, even with the pen, keep that exhale and that lift for a couple seconds. 2 to 5 seconds if you can. So rather than, this isn't going to benefit you at the beginning. Soon. We had a...
Do you have, Jessie, do you have the exercise?
So the kneeling press, some of you think, I like to be too hard in the beginning, so you kind of come down seated, and that will happen, and then be more focused on what's happening in the floor. And then once you've mastered here, then you can come to that full extended position and add a little bit of challenge to it. We've had also the kneeling chest press,
which you can do laying down as well. Yeah. So I'll show that. So yeah, we just did that. So just what we just did, like that one showed on the ground. So that one on the ground. So you want to think about the exhale
being
quite smooth and consistent throughout the breath rather than a
See the difference? That makes sense. No, you'd be surprised. Like this doesn't mean that your belly's going to come in faster. A lot of women think that it will, if you can really push and find that connection, but it's actually going to do.
It actually won't. You'll find that. What I see a lot in the women that I work with is that the ones who've done that is that their upper ribs are in, and then their lower belly they have. What we call sometimes like the mom pooch, like down here. They come to me like, I want to get rid of this. And then we have to go back and be like, okay, how do you breathe? And that's when I use the balloon method.
They have a line here.
Yeah.
Sometimes when they breathe through the upper belly, only here, they have like a really line here. It's so clear.
Yeah. So again, think about a smooth breath, kind of this elevator kind of motion. I know you wanted to talk about diastases.
Yes.
Yeah, so I just want to do that.
Any questions about diastases?
It's a hot,
No, hot point.
the separation
So-
between the halves.
Yes.
A lot of clients that come that have, a year post-delivery and still got diastasis.
Yeah, very common.
Yeah.
Yeah.
So from what I hear, like a lot of women have it, whether it's 4 centimeter or 2 centimeter, but depends what we do, it can be recovered quickly. But I was asking somebody, so I stopped the core work, but then because I had low back pain from before, so there is some workout to strengthening my TVA, transverse abdominal. So there was some workout, and then I was done. So I was not doing any crunching or any navasana, nothing. But then one day I kind of looked at my belly, it was a little dome shape. And then I was told that for those who have a stronger abs before pregnancy, it can happen. So obviously I tried to not look at it, I always roll. And I even don't do and that TVA exercise. It's just breathing, it's all four, it's not like crunching or anything. So about finding that dome shape during pregnancy, I'm asking a lot of during birth already have it. So is that something related to, does it mean I'm gonna have
What you want, the good news or bad news?
both? Yeah.
So you have the dome shape now you're saying.
If I don't know now. I haven't checked since.
Okay.
Wait, relax. Don't need to show me.
Yeah,
21 weeks, 35% the woman has diastasis. 35 weeks, 100% the woman has diastasis.
It's like a baby. Think about like opening curtains. That's what the baby does. The baby's like, hey, everyone's abs split. It's just gone crazy with the
So,
media. Oh, diastases. No, it's actually an anatomy thing.
thanks God you have diastasis, you have space for baby. We want big babies, healthy babies. And the strong abs, I want to be pregnant next year, so let me train my abs in order to not have diastasis. No, the baby needs flexible muscles, so the baby needs space, okay? This is during the pregnancy. Every week I have a call to ask, do you treat diastasis? I don't. We have a really huge lack in the studies about diastasis. Diana Lee created the book, and there is a book about that. If you work on your transverse, you're gonna improve your diastasis. What they say is, if you see the studies, what they say is when you do crunch, for example, when you do a sit-up, the diastases open a bit, and when you do transversals, the rest of the abs close a bit. And after the birth, what happened? Can I write down something there? No. Can I go there? Just to explain. Okay, so the diastasis is the gap between the abs. Okay, the belly button is here. What the if you work on your transversals, the rectum starting to be closed, okay? And the tissues here, most of the time in natural women, in no mom's woman, the tissues are like that. And after the birth, when they close, the tissues are like that, not clear. That's the only thing that Diana Lee understood, okay? Then we have a small study. It's not clear because it's a small study in few people, and they say like if you have big diastasis, you can have pelvic floor problems. It's not really studied. And another thing, what they say is the types of diastasis can be here, close to the belly button, can be
On the upper abdominal.
here, or it can be here is bigger.
We got it, the lower.
Yeah. Left. Okay. I'm doing left. Okay. Doesn't matter. So upper belly button, under belly button, and under belly button. Okay? And what I'm talking about, it's not evidence-based, but I believe that you need to see which type of diastasis they have to choose the better exercise for them.
Yeah.
This is the most important thing, not the gap and how much they are separate, but where is the diastasis. All of these studies saying that diastasis is more than 1.6 centimeters. I have 1.6 and I don't have babies. So what is different? What is normal or what is not normal? I can show you some photos from weightlifters. They have a lot, and they don't have any troubles because the tissues, between the rectums is really different also because of your genetic. Okay, Asiatic women has the tissues different than the European women's. There isn't any relation. Okay. If you start working with the breathings, with the connection, with the lifting, you will see the difference. Of course, we don't want any bulge. During the pregnancy is really normal. Okay, after the pregnancy, we don't want that. We can start to work, and some women, I teach the transverse connection, but in another women's, I don't. One of the things that they found is the good. There are two things that the women after birth lose: abdominal wall strength and thoracic rotation. Okay, weak thoracic rotation. So if you work on your thoracic rotation, you can start to increase the strength of the abdominal wall. So most of the times, I have two types, transversal or thoracic rotation. When you do this exercise or this exercise, if you work here, you're starting to increase the strength of the abdominal wall. But it's good to see how they are contract, if they are connect with the lower tummy or not.
But if a pregnant woman sees doming in the belly, say you're doing a push-up, and doing a push-up with their knees down, and she sees doming in her belly, should she not do that move anymore?
Sorry, can you say again?
So say, I'm pregnant and I'm
Yeah.
doing a push-up with my knees down, and then I notice that my belly is a cone. It's coning.
Pregnancy is normal. After birth, you can teach some breathings during the push-up and will helpful for them. Like breathing out and try to lift. But come on, you have the gravity. So it's normal to have some bulge there, but not really clear. Okay? And we still don't know what's going on and what's really happened with the diastasis. But I believe that one thing is to have 2 centimeters of diastasis, and you only can put your top of the finger. It's really different than you have 2 centimeters of diastasis, and you can completely go in. I cannot treat the women at the same ways when they can put one finger or when I can put my hand there. Okay?
So when is the best time to get checked up? What type of diastasis you have through the specialist?
We still don't know.
Okay.
We still don't know about that. But I believe it's the same like a urinary incontinence. You can improve yourself till 6 months.
6 months.
And the postnatal, sometimes the postnatal is till 2 years. Okay? And if the woman come on after 2 years and they have a big diastasis, huge diastasis, clear diastasis, we can work on that, of course. Starting to be connection with the breathings, and you're going to recover better. Keep active, okay? So that's you said, if a woman has a stronger abs, but it's not clear like that, I cannot say like this is because of that, but it's because your recovery, it's easier if you are active, of course. Okay? I think we talk about the scar tissues that I think I told you like C-section, try to touch there. You want to talk about the nutrition, breastfeeding?
I guess our 2 points were just make sure that if you decide to go to weights and you've been cleared or any type of activity, that you just get someone qualified, because there's a lot of people out there who aren't and who are coaching as if it hasn't happened and that needs to change. So breathing, everything, the way you do the movements, the positions, really important. So just make sure you get someone qualified if you are going that route. And then just quickly with nutrition, with breastfeeding, it really depends on what's going on and what you choose and what's going to make, for me, because I had postpartum depression with the first one, I'm always like mental health first. So if you are breastfeeding and you feel like, oh my gosh, I can't do this or whatever, it's bringing you down in different ways, then just drop it, like do you. But I do want to make a point that if you do decide to train, so when I was breastfeeding this time around, if you decide to train, I went back after, I think about 8 weeks or so. You need to eat. A lot of women are like, oh, I want to get my body back and this, and I get that. I had all those feelings too. But you have to remember that you lose a certain amount of calories per day, up to 500 to 800 depending on your baby. I feel like boys are worse. I don't know. Just like suck you dry. So 500, 800 per day, and then you need to, if you're going back to training and you're going to burn 300, that means you need to eat like an extra 1,000 calories a day to keep up your milk, depending on how you're supplying or how you're getting that. So a lot of women go back to get their body and they don't do that, and then they lose their milk and they're like, oh, exercise made me reduce in milk, and it was likely because they weren't eating enough. But that's a whole nother tutorial. Yeah. So I think that's it for now. Do you guys have any questions? There's lots of exercises you can do that are out there. But yeah, if you have any specific.
I follow you on Instagram, so I saw while you were pregnant, and because you're talking about TVA, and I saw you were doing a lot of exercises while pregnant.
Yeah.
So is that good preparatory work then for the?
Yeah, definitely. I think where I would say that I didn't do enough was when I was, around 30 weeks or so. I think you need to practice more of the letting go rather than the TVA, rather than the activation. So I think you're 20 something, right?
Yeah,
24.
Yeah.
Yeah, so that's great. You're still doing that and still having that engagement. But then when you get to about 30 weeks or so, what preps you more for birth would be the release of that. You can do a combination of both, but I was really just focusing on the TVA.
You're like a superwoman in Chris fell over. Like, I feel so lazy.
No, I had my lazy days.
So desperate.
I would order 2 McFlurries, and my husband is lactose intolerant, and I knew he wasn't going to eat it. But I was like, I got you one. But it was for me. Yeah. Anything else?
So the release exercises are also in the PDF. What
The-
do we get?
The breathing.
Or some of the
So they're
explanations.
the same exercises, but instead of thinking of the contraction, you
The-
want to think about the relaxing through the inhale. And that the cue that Allie uses, which is really nice, and we've put in the PDF, is that opening the sit bones.
Yeah.
Trying to feel that sensation of opening. And like for all of you that are coaches, and I loved your question, Nora, about like if this is relevant at other times. Most people don't breathe properly, and as coaches, this isn't just relevant to pregnant women. All of our clients have breathing and pelvic
Yeah.
floor dysfunctions, men as well. So these should be like, we should be checking this, like, do they breathe the first time we train someone? And this should be foundation to all the other training that we do. So all of these exercises, that's why I kept saying, like, coaches, even if you don't work with pregnant women, like, this is information that are relevant to humans.
Yeah. And it sounds weird, but the sensation of the letting go is really the sensation of doing a number 2. So like that kind of total release and trying to kind of hold that, if that makes sense.
Yeah.
Yeah, so learning to really just feel that. And the best way to do it for me is like from here or in the side, because your sit bones are already forced to do that. Yeah.
But please don't think about doing poop like.
No.
It's exactly the opposite. When you
It's
do that, like,
yeah.
you are doing all the. I always say, like, don't put the energy here. Put the energy downstairs.
There are tools, that do help. Some are not, I don't even think they're available in the country, but there is, they're like, I know they're like simple balloon catheters.
I have.
Yeah, I had one. That was the only way in terms of like the pushing. So with my first one, I learned that I was pushing like that. I was pushing when she was coming out, like, and I'm pretty sure that was the reason why I had so many tears. Whereas my second doctor was like, okay, push halfway, stop, because your muscle gets used to it, and then just relax, and then the next contraction we would ride through the push and go together there, and then she would tell me just like, relax, stop. And I'm like, how do you stop? It's coming. So with these tools, the one I use is called the Epino, and it really helps with that, to let go of the pelvic floor.
I can show you.
Oh, you have it? So it looks like almost like a bigger tampon that you stick up. And then there's a little pump on the end of it, and then you pump it up, and that tampon gets bigger into a balloon. And then from there, you basically take an inhale and exhale and try to pull out that balloon inflated. So it's to simulate a head of a baby. And it's so helpful. But near the end, it was like 38 weeks, and I could feel my son kicking out the balloon. I was like, then come out. Come out if you're ready. Yeah, this is it.
So this is a balloon, but don't be scary.
Don't be scared. It was the most helpful thing in terms of letting go. Oh, it's amazing.
You said you didn't fail.
For the second one, no. And he's 4 kg. He was a 4 kg.
Wow.
Yeah.
I used to wear these for 2 reasons: to teach the pregnant woman to let it go and push out.
He's saying it like Elsa.
And also after birth for strength of pelvic floor.
Yes.
Because you can see here how much are you contracting or not. I have another tool that it's a medical tool. You cannot have this at home, but I'll show you. You have a small probe. Like this. Okay?
Yeah.
And
Yeah.
have some sensors here. Okay, and I put it in on the woman, and you can see on the display how much are you contracting. Okay, like how much our pelvic floor is higher. So then
I
the
know,
lights
it's
come
8
here,
centimeters.
and then when you release the pelvic floor, the lights go down. Okay, I'm here. So let's hold here. Here, it's the number that we want. Okay.
So this is
that's
so
not,
helpful.
It's not only with my finger there.
Yeah.
These tools is really important. And when you come in and you see on the display, well, I'm in 14 or I'm in 6, you already be connect with the pelvic floor. Like, okay, I'm not really relaxed.
Yeah.
That's how I ask you if you are sure if you're contracting or relaxed.
So this is really helpful. This helped me because she put the probe in and I was at 11 and she was like, you think you're relaxed? I'm like, yeah, I'm relaxed. Didn't move, 11. Went home, borrowed the machine, whatever, and then I got down to a level 2. So it's that sensation of learning how to let go. Those are so helpful because I'm a numbers person. You can't, I am. So yeah, I put it in, this would be, and then you'd pull it out like this, and it can go to 10 centimeters to prep you. I got to 8. Then I was like, let the rest happen. So you pull it out like this. Lots of lube, ladies, lots of lube.
When you put it in, it's not like that.
Yeah, it's like this, and you put it in, and then you lock it, and then you pull it out full.
Can you send us the name of those two devices as well?
Just this one. That
Oh,
one you
yeah.
can't.
Yes.
That one you can't because
Oh,
you
yeah.
need a medical report.
Okay.
Yeah. But there are facilities.
This one,
here.
like.
There's
in
knockoffs
Europe.
of these now.
Sorry.
There's knockoff of the Epino now that my clients are ordering here, and it's okay.
Oh, okay.
Because I know the
Fine.
Epino, you can't. I had to get one of my clients to bring it in from the UK. But I'll get the other product. There's other balloon catheters that are available now. And they do say to start, I don't know why, they say to start using it at 34 weeks, but I started at 30 to get the sensation of letting go because I was struggling with that. Yeah.
30, well, I would like to say, it really depends on the woman, of course.
Yeah, it
but
does, yeah.
The safe line is 34 weeks, okay? Because it really depends on your condition and how is it. And if you already have the pelvic floor with a lot of bulge, there are someone who has the prolapse during the pregnant side, so it's not for everyone. Okay, my advice again is look for someone to help you to assess yourself and then try to find what's work with you. Okay, it's not for everyone, just to let it know this is it's available. That's it. Any other questions? Nothing?
Great. Thank you so much, ladies. This was super informative. I know I learned stuff. So if you do have, if like you go home and you think, oh, there's something I did want to ask a question about, you all have my email and we can connect you and make sure that any questions that do get answered. Also, if you think, I'd really like a workshop on something else, part of what we're doing with Shira Life, and we're hoping to continue collaborating with just to continue doing workshops like this. So I'd love to hear from you on what we can do for you that you're going to find really beneficial and helpful. Also, I know some of you are members of the Shira Life and a lot of you aren't. So we have created this platform to give quality education to women. So a lot of these workshops and things we do at a massively discounted rate for members. And we do then create video content that goes into the membership site that's always available for members. So if you know people and you're like, oh my gosh, I really think that they should see this, it's available for members, and it will be available after. If you don't want to be a member, you can. If you've got a friend who's like, oh my god, they needed to see this, that will be available for purchase as well. So it's always going to be around. Also, if you need bands, we have those for sale as well. But like I said, if there's anything that you think I'd really, really love to know more about that, I want to know so that we can make sure that that content is being created for you and that we're giving you the very best access to incredible teachers and education possible. So thank you so much for coming.
Thank you.
Thank you. Thanks.